BCEN Practice Test 2026 Board of Certification of Emergency Nursing Exam Questions. Question 1. A patient presents to the ED with sudden onset of the worst headache of my life. What is the most likely diagnosis? Migraine, subarachnoid hemorrhage, SAW, tension headache, cluster headache. A thunderclap headache is a classic presentation of a subarachnoid hemorrhage. Question 2. Which medication is the first-line treatment for anaphylactic shock in the emergency setting? Diphenhydramine, epinephrine, methylprednisolone, albuterol. Epinephrine is the critical life-saving drug for anaphylaxis. Question 3. What does the C in the ABCD assessment stand for? Control, circulation, consciousness, calibration. ABCD stands for airway, breathing, circulation, disability, and exposure. Question 4. In the triage system, ESI, what level is assigned to a patient with stable vital signs and needs a simple diagnostic test? ESI Level 1, ESI Level 2, ESI Level 4, ESI Level 5. Level 4 is for patients who are stable and require only one resource. Question 5. What is the standard treatment for a patient experiencing a suspected myocardial infarction? MONA, morphine, oxygen, nitroglycerin, aspirin, antibiotics and fluids, insulin and dextrose. Observation only. MONA is the traditional mnemonic for initial ME management. Question 6. Which sign is indicative of cardiac tamponade? Beck's triad, hypotension, JVD, muffled heart sounds, Cushing's triad, positive Hohmann's sign, Babinski reflex. Beck's triad is the classic clinical presentation of tamponade. Question 7. What is the priority intervention for a patient with a tension pneumothorax? Chest X-ray, needle decompression, endotracheal intubation, for fluid bolus. Tension pneumothorax is a life-threatening emergency requiring immediate needle decompression. Question 8. In a patient with a traumatic brain injury, what is a normal Glasgow Coma Scale, GCS, score? 3, 8, 12, 15. A GCS of 15 is the highest, best, possible score. Question 9. What is the characteristic rhythm of ventricular fibrillation, VF, on an ECG? Regular, narrow QRS complexes, chaotic, wavy line with no identifiable P waves or QRS complexes, sawtooth pattern, slow, wide QRS complexes. VF is a disorganized, lethal rhythm. Question 10. What is the target blood glucose range for most critically ill patients? 70 to 100 mg/dl, 140 to 180 mg/dl, 200 to 250 mg/dl, 60 mg/dl. Targeting 140 to 180 mg/dl is generally recommended to avoid hypoglycemia while managing hyperglycemia. Question 11. Which electrolyte imbalance is most commonly associated with Torsades de points? Hypernatremia, hypomagnesemia, hypercalcemia, hypochloremia. Low magnesium can lead to a prolonged QT interval and Torsades de points. Question 12. What is the purpose of the FAST exam in trauma patients? To determine the speed of the ambulance. Focused assessment with sonography for trauma to detect free fluid, blood, in the abdomen and pericardium. Functional ability and strength test. Finding all serious trauma. FAST is a rapid bedside ultrasound. Question 13. A patient is brought in after a chemical splash to the eye. What is the priority nursing action? Applying antibiotic ointment. Checking visual acuity. Immediate and profuse irrigation with saline or water, patting the eye. Irrigation is the most critical first step for chemical eye injuries. Question 14. Which type of shock is characterized by high cardiac output and low systemic vascular resistance, SVR? Hypovolemic shock, cardiogenic shock, distributive shock, example sepsis, obstructive shock. Septic shock typically involves vasodilation leading to low SVR. Question 15. In pediatric resuscitation, what is the preferred site for intraosseous (IO) access? Proximal tibia, distal radius, proximal humerus, sternum. The proximal tibia is the most common site for IO in children. Question 16. What is the golden hour in trauma care? The hour before a patient arrives at the hospital. The first hour after injury when prompt medical treatment has the highest likelihood of preventing death. The time the surgeon takes to operate. The hour of discharge. Rapid intervention within the first hour significantly improves outcomes. Question 17. A patient has a suspected cervical spine injury. How should the airway be opened? Head tilt/chin lift, jaw thrust maneuver, oral airway insertion only, nasal cannula. The jaw thrust maneuver avoids neck extension. Question 18. Which condition is characterized by a strawberry tongue in children? Kawasaki disease, croup, epiglottitis, asthma. A strawberry tongue is a hallmark sign of Kawasaki disease. Question 19. What is the most serious complication of a deep vein thrombosis, DVT? Leg pain, pulmonary embolism, PE, skin infection, varicose veins. DVT fragments can travel to the lungs, causing a life-threatening PE. Question 20. Which medication is used to reverse the effects of an opioid overdose? Flumazenil, naloxone, Narcan, atropine, activated charcoal. Naloxone is the antagonist for opioid receptors.